Good evening. My name is Rachel Allen, and I'm the chairperson for the Celebrating Survivors Event Committee and a Women's Center and Shelter board member. I want to thank the Craig family for again presenting this prestigious award, which we do annually at the Celebrating Survivors events. Tonight, I have a special announcement on behalf of the Craig family. As of this evening, the Craig family would like to officially announce that the Ted Craig Humanitarian Award will now be known as the Shirley and Ted Craig Humanitarian Award in recognition of the passing of the family matriarch and our beloved friend Shirley in 2020. The award's purpose, which is to recognize the efforts and actions of an individual or organization who has positively impacted the lives of survivors and their children, remains the same. Since the time of Ted's passing, Shirley lovingly presented the award each year, served on the event committee, and looked forward to seeing friends and family to celebrate during the event. The renaming of the Shirley and Ted Craig Humanitarian Award is symbolic of the partnership between Ted and Shirley that brought about children, grandchildren, and great-grandchildren who will carry on their legacy of love, loyalty, and service. The Craig family is proud to present the first ever Shirley and Ted Craig Humanitarian Award to Dr. Raquel Buranosky, founder of Women's Center and Shelter's Medical Clinic. Now, let's take a look at this video, which highlights Dr. Buranosky's work for volunteer medical students and staff in the medical clinic at WC&S.
It was completely volunteer run. So it was me and about 3 or 4 other physicians and some medical students. And we have 4 medical students who coordinate all year long. So the 4 students do the scheduling, they handle all the inventory, and now we have pharmacists that do the same thing. We have pharmacists that come and stock our medicine cabinet, create our smoking cessation program, and all of these people are still doing it on a volunteer basis. And the students were really the backbone of that process. And then the umbrella organization is called Program for Healthcare to Underserved Populations. So when we started it, it was just the Birmingham Free Clinic and us, and that's grown, and Mary is the coordinator for all of that.
A lot of what we do is help to create a pipeline of providers across continuums. So it might be medical students, but it might be pharmacy students, it might be AmeriCorps National Service members, but to help them find their role and their power in not just being a better doctor or a more well-rounded doctor, but also how to become an advocate. I get to do that on a very boots on the ground kind of level with Raquel, particularly with the students, and then watching them come back from their experiences at the shelter and seeing how that's really molding and changing them personally and professionally, and how they learn to then pay it forward and be an advocate and hopefully train other students as they become professionals. And I think that seeing that come full circle is really profound and really special to be a part of.
It's important for our residents to have the medical care right within the safety and security of our building, so they do not have to leave to go outside of the building for medical care. So that protects their safety and security. Oftentimes, prior to coming into shelter, residents are isolated. They've been denied access to medical care from their intimate partner. We see residents that have neglected medical needs, untreated injuries due to the physical violence, and the ability to have those needs met right on site by the medical students who are caring and compassionate and understand their unique needs is really important.
I think our residents are treated differently with the med clinic and the students that come into the program because they're already coming in with understanding of what it means to be trauma-informed. Some of them do have background in what it means to be a DV survivor and victim. And so the first thing that they do is they try to create a safe space. And I think you can see that in the room that is used for the med clinic. There's pictures on the wall. The setup is really warm and welcoming. And just the approach, as soon as the resident comes in, they greet them, they introduce themselves, they let them know kind of what their purpose is there. And then they kind of just ask them what their need is and what they're looking for out of the clinic. And with that, starts to come their stories of abuse related to medical needs.
I think the most challenging thing for people to realize, and the medical model doesn't fit that well, and that's the training that we have to do, and I think that's what the students learn, and then our ambassadors to other physicians, older physicians, everybody, when they realize this is the one thing that you really cannot and should not tell your patient what to do. And I think working at the shelter, the students, me, my attendings, my friends, we all come away with such a deep respect and an amazing sense of inspiration from these women, realizing that when you're in their world, they don't want or need you to save them, and they don't want or need you to tell them what to do, but they do need you to guide them because they're busy surviving, and they just need sometimes some resources and a minute to think and to focus on the aspect of this part of them.
I'm really thrilled for Raquel because I think it's very well deserved, the work that she's done. But I think as a program also, when we're recognized by other entities or colleagues or organizations that we really respect and that do great work, it helps us to know that we're on the right track, that what we've been doing and what we continue to do is valuable. It's valuable to the folks that we're serving. It's valuable to the agency.
It's been an honor working with Raquel. I really would like to thank her for her dedication and commitment to Women's Center, our staff, and most importantly, our residents and their medical care over the years.
She, makes it a point to get to know our residents as much as she can in that brief time that she's with them. She follows up, she emails staff back and forth asking and checking in on the residents. And they really look forward to seeing her whenever she's in, the shelter. And then after they leave shelter, a lot of them want to see her, as a PCP or want to be connected somehow to the clinic. It's been one of the things I've noticed in the past couple of years is, residents really feeling like now they're equipped with the information and the resources that they need in order to kind of, start to heal, whether that's physically, mentally, emotionally, to start over.
The residents that we see are the strongest women I've ever met. They are not stereotyped into people that somehow made bad decisions and it's an us-them phenomenon. This is something that happens and can happen to anyone, and when the residents share their stories, I think that's very apparent to our students, even if you are only there once. But I think what I want people to know is that this isn't a bunch of broken people. These are actually really strong survivors who are amazing, and they inspire us with their strength. They are amazingly getting their lives together with some support, and that for a situation from the outside that looks almost not fixable, it's amazing how much they accomplish within such a short amount of time in rewiring their entire lives and getting back out and living.
On behalf of the Craig family, it is my pleasure to present you with the first ever Shirley and Ted Craig Humanitarian Award. Congratulations. Dr. Buranosky, the floor is yours.
Hi, everyone. Good evening, and thank you for inviting me here tonight. This award means so much to me, and I want to thank the Women's Center and Shelter and the Craig family. When I found out I was getting this award, I was actually quite surprised. This is work that's always been meaningful to me and doesn't feel extra or amazing, especially when working at the Women's Center and Shelter, I see all the work that's done there. The part we play just seems to be so small. But it gave me some time to reflect then on the last 25 years of doing this work and talking to my team about it. We had these feelings of relief and excitement that the work that we find meaningful is something that's meaningful and valuable to you as well, which is our ultimate goal. So thank you so very much. I remember when I was asked to start this clinic in 1996, I was resident in the VA ICU, and Dr. Tom O'Toole, who was running our program for healthcare to underserved populations, which is our umbrella program, told me that I had this opportunity to open a women's center clinic in our local shelter. He knew my interest having been a domestic violence advocate on the hotline in North Carolina, having worked with the Mercy program out of their ER. So I was very excited, but I was also very tired and pretty messy, and asked if I could wait a month until my outpatient rotation. He said, probably not, we might lose the opportunity. So I went down the next day. I was post-call, I was still in my scrubs, and I probably freaked out Cheryl Reagan and Filomeno Vivaro, and they were probably wondering what they were getting into. But 25 years later, we're still here. When we look back, I look at our goals that we created a long time ago. The first was to provide care for the women in shelter, meeting their needs in this gap time, hoping to empower them in their healthcare, as well as maybe even finding referrals for them to good doctors when they left our shelter to where they would land. This award means a lot because it means that we're on target with that goal. The second one was loftier in a way, and that was to create better doctors and providers for the future by allowing these volunteer students into the shelter to experience the life that these women live and the challenges they face and the role that future doctors can play. I want to thank that shelter group and all of you for trusting us. Having been an advocate on a hotline, it's hard to move from grassroots to allowing people in who you don't know how they may treat this vulnerable population. But the rewards have been many. On a local level, I'm often stopped in the hallway and doctors will say to me, hey, Raquel, your students are teaching me a lot about domestic violence. On a national level, our graduates from this program have gone on from in the pharmacy area, specialty areas, medicine areas, to lead leadership roles in public health, women's health, domestic violence, advocacy. As recent as last week, one of our graduates, she was a student 10 years ago, Dr. Jillian Kyle, just got a paper published that outlines her intern curriculum for our internal medicine residency program, where we train all of our residents in identifying intimate partner violence and helping to intervene. Our pharmacy students are also amazing. They've started our smoking cessation program here, and they're with us every week in our clinic. 2 of them have recently won fellowships for their excellence in their programs, in particular the smoking cessation program, and will be doing public health work in the pharmacy world because of some of this work. So these are amazing accomplishments. But as everything, it takes a village, and I just want to thank our volunteer attendings who have been with us for all this time on Monday nights, no matter what, through COVID, after COVID. Our amazing students, our volunteers. They raise money, they do fundraising, they do promotion, and they do a lot of peer teaching and ambassadorship for our cause. I think our patients are amazing, and I want to thank our women and our patients and our women's shelter staff for trusting us and continuing to invite us down on Monday nights. And for our staff in particular, making those Monday nights a place that we want to be. It's just a special place to be. And we all just really appreciate it. And also for my division of general internal medicine at UPMC and the University of Pittsburgh Physicians Group, as well as the School of Medicine, for supporting us in continuing this work. In 2000, I went to my general medicine division chief, Dr. Wishwa Kapoor. And at that point, this was a grassroots kind of cause between Tom O'Toole, me, Mary Herbert. And we said, look, if we leave, this program crumbles, and that can't happen. Let's get some institutional support. And he went forward and hired Dr. Twee Bowie, who many of you know, who has transformed our larger program and this one into a sustainable activity with the help of all those organizations. So we're looking forward to even bigger and better and future things, and awards like this really are inspirational. I can't thank you enough. I just want to end with this lessons learned that I coincidentally found yesterday on my email. It says, if you love what you do, you can do it forever. If you can find friends in your journey, the burdens are lighter, the victories sweeter, and accomplishments will be larger. You won't always win, but every win is a gift. So I look forward to more wins, more gifts, more time, and thank you again to the Craig family for this award.